Hello, this is Lisa Moyer for Winthrop University. This lecture is entitled All You Ever Wanted to Know About Gender But Didn't Dare to Ask. I recorded it for my FACS 350 Parenting Across a Lifespan class. And the reason I am focusing on this topic is because we are now in the stage of studying how parents help or assist with child development, and gender identity is part of the identity of the self, which is where we are focused right now in class. So psychologists believe that a person's core identity has three separate major components: gender, style of behavior, and sexual orientation. Gender identity refers to the deep inner feeling of gender, whether somebody is male or female, or neither, or a little of both. Style of behavior, it just refers to somebody's natural inclinations and expressions. Sexual orientation refers to whom one is attracted to emotionally, intimately, and physically. And again, these components are separate and distinct from one another. So it's not possible to predict one by looking only at predict another one from one of the categories. So you can't predict somebody's sexual orientation just according to their style of behavior or their gender identity. And you can't determine someone's gender identity necessarily just from their sexual orientation. So these are all separate components. It's important to keep that in mind. One of the questions that I get a lot when I am teaching is, how common are transgender children? So transgender children, this refers to whether somebody has been assigned a gender at birth, a sex at birth, really, male or female, and then realizes as they grow up and develop that their gender identity doesn't match the sex that they were born with, so the sexual characteristics. And so they will identify as a gender different from the one that they were assigned at birth. If somebody is not transgender, they are cisgender, CISGENDER, cisgender. This means that your gender matches the sex characteristics and organs that you were born with. So how common is transgender? It's estimated that 1 in 500 children are gender variant or transgender. And so somebody can be gender variant as well, which doesn't mean that they're transgender, but that they don't adhere to traditional gender sex roles, stereotypes, dress, behavior, etc. And gender variance or nonconformity, they fall outside of what is considered typical. So, for example, a male that prefers long hair, a female that never wears dresses and plays football, etc. So how can you tell if your child is transgender? Well, there are some pretty specific markers that are important, but these behaviors that I'll talk about in just a moment have to continue for more than 6 months. And it's these 4 things that are more predictable for determining whether or not a child has gender identity. Sorry, this is a tongue twister. So according to Dr. Spack, there's bathroom behavior, swimsuit aversion, underwear, and toys. Meaning bathroom behavior, so children have an aversion to using the bathroom that is related to the sex that they were assigned at birth. A swimsuit aversion, not wanting to wear the swimsuit that would be typically assigned to the gender or sex they were assigned at birth. The same with underwear, not wanting to wear underwear that matches the sex that they were assigned at birth, and the same with toys. It's these 4 categories that seem to be more reliable when it comes to determining whether or not your child is transgender. Fortunately, children can tell you. They can communicate and use vocabulary at that point, and so they know. The vast majority, however, of gender variant children are not transgender. They just don't conform to gender stereotypes and rules and roles. And remember, the behavior has to continue for more than 6 months, and children know. So the DSM-5 determines, first of all, the DSM is called the Diagnostic Statistical Manual, and it determines how mental disorders are defined and diagnosed, and impacts how people view themselves, as well as how they can access care. And you have to be careful with giving names that are stigmatized, or have some type of negative connotation associated with them. So it used to be in the DSM-4 that gender dysphoria was named gender identity disorder. But there was a conscious decision to change disorder to dysphoria to reduce the stigma associated with a disorder. So gender nonconformity in and of itself is not a disorder. At the same time, it has to be listed in the DSM-5 in order to allow people access to care, because that's what doctors and psychologists, psychiatrists, social workers, etc., that's what they use to determine whether or not somebody has the official diagnosis. And then they can treat them. And this is really important when it comes to insurance. So we've discussed insurance in other classes. I think you understand how important of an impact it has on people's lives. And without having access to treatment, many people can't get the treatment that they need to cope and to transition, if that's what they choose, or to stop from developing the sexual characteristics that come with puberty. So they may take hormones to stop that or mutate it. Hopefully that makes sense. The official diagnosis of dysphoria, gender dysphoria, there has to be a marked difference between the individual's experienced gender and the gender others would assign them, based upon their biological sex characteristics. This behavior has to continue for at least 6 months and must cause the patient significant distress and impairment in social, occupational, or other important areas of functioning. Lots of times I get asked about drag queens, drag kings, and cross-dressers. This is not the same thing as transgender. Drag is a gender performance for an audience, and it's been used in theater for years, centuries. It's still a huge part of queer culture today, which is why you will see drag shows often used for fundraisers or for entertainment in either gay bars or LGBTQ-friendly bars or other places where the community might get together. Cross-dressing is wearing clothing of another gender, and it's done to step into a forbidden social role, explore a different identity, shake things up, express a different part of oneself, or just for fun. It is not transgender, it's not part of the identity. It's just wearing different clothing. So hopefully those two help to give an idea of why that's not transgender. So the entertainment or wearing clothes to shake things up, not the same thing as your identity development, your gender development being different. Pronoun Dos and Don'ts. This is a big part of gender talk because it's a big deal now in society to use appropriate pronouns. When somebody asks you to use a different pronoun, don't say what. Don't you have something more normal that you use? And don't say, well, it's just not grammatically correct or it's not right. You're not being asked to evaluate somebody's gender identity or their preferred terminology. You are being asked to use a pronoun that person feels is more acceptable to describe them. And it's completely okay to just ask. When we use pronouns like she or he to identify a person, we might be making an assumption about that person's gender that differs from their gender identity. So just ask. It's a sign of respect. When someone shares their pronouns with you, they're asking for your respect. If you choose not to use them, you're invalidating their identity and being disrespectful. And you also could be putting them at risk, in danger. You can out somebody by using the wrong pronoun. It may feel uncomfortable for you at first, but this isn't about you. And if you refuse to use the correct pronoun, you're saying, I need to be comfortable, and my comfort's more important than your comfort and identity, and potentially safety. So you'll notice on my email, my signature, I have my preferred pronouns, and that's what a lot of people are doing now. If they're trying to be inclusive, you want to let people know ahead of time what your preferred pronouns are so they feel comfortable using them with you. That concludes this lecture on gender development. We can talk about it more in class, but hopefully this gives you a quick overview of the topic of gender identity and transgender.